Okay, this video is, do bras cause cancer? And it's kind of an interesting subject because the big push for this came from a book called Dress to Kill by Sydney Singer and Soma Grismaijer. And they said that the bra, when it's tight, it would impair the lymphatic drainage from the breast and cause a backup of the lymph. And the backup of the lymph flow, that's the extravascular fluid that the white blood cells, the immune system circulates through. When there was a backup of that fluid due to compression by the bra, it would lead to leakage of fluid, and that would cause breast cysts. And the same patients who have breast cysts had an increased risk of breast cancer. Okay, about a 6-fold increased risk of breast cancer. And it's kind of interesting. Everybody knows that deodorants increase the risk of breast cancer. You put deodorants in the armpit, the lymphatics between the armpit and the upper outer quadrant of the breast are shared. The deodorants typically will contain aluminum. Aluminum is a metalloestrogen, meaning that it'll stimulate proliferation of the breast ductal cells. Anything that stimulates proliferation, replication, means that they could potentially stimulate replication of breast cancer cells. The aluminum plugs up the pores, which decreases the ability to detoxify the sweat to extrude waste products. In addition, there's a preservative in deodorant. It's typically going to be something like a parabenzoic acid. Those are estrogenic. So right there, we're going to count the number of estrogenic, cancer risk chemicals a typical woman puts on herself every day. You'll be amazed. We'll really easily get over 10 of them. Aluminum and parabenzoic acid, okay? The next thing they do is they often shave their armpits. Well, when you shave the hair off, you shave some skin off, you increase transdermal absorption. In chemistry, like dissolves like. Estrogen is a lipid, meaning a fat-like chemical. And your skin is primarily fat-like. It's designed to keep water out. Water is polar, okay? Whereas lipids are not polar, okay? So your skin is designed to keep water out. You swim in the water, you don't immediately become waterlogged. But you know what? Fat stuff is absorbed right through your skin pretty easily, quite often, all right? The next thing is your clothing. Typically, people will wash their clothing in a detergent like nonylphenol, for example, and it comes in a container. The container itself is plastic, typically made out of something like BPA, bisphenol A. That's estrogenic. Typically, the plastic has, BPA is like hard plastic, and then it'll have a softener to condition and shape it, and that'll typically be a type of phthalate. Okay, so that right there is another estrogen. So the deodorant is 2 estrogenic chemicals, the detergent is 3, the detergent container is 2 more. Now we're at 5 estrogenics. And they expose to the breast because women wash their bra and their t-shirts in these detergents. By the way, I don't use any laundry detergent. You don't need to. You don't need deodorant. It's stupid. You walk in the room and say hi. You don't sniff each other's pits. You throw your laundry in hot water. You don't need to use detergent. I haven't used detergent for decades, not since I was in college, okay? Many bras contain formaldehyde. Formaldehyde is a carcinogen. That's what you use when you put on a corpse, embalmment, okay? It's carcinogenic. It's also neurotoxic. The tighter the breast, the more it compresses the breast, the more it impairs lymphatic flow. If a woman never has a baby, that's considered unopposed estrogen. If she has an abortion, that increases the risk of breast cancer as well. Breastfeeding a baby. The longer she breastfeeds a baby, the better. For example, if she breastfeeds for 2 years instead of just 6 months, that lowers the risk more. A lot of women breastfeed only, for 1 month or 3 months. Some don't even breastfeed at all. Pectoralis muscles, they atrophy if a woman wears a bra. In all these countries and in the past, up until the last couple hundred years or so, women didn't wear bras. And in these other countries, I remember when I was a kid, one of my friends said, look at this, National Geographic magazine. These women are not wearing anything on their chest, okay? Let's see, what else? Lack of exercise. When you exercise, it's your muscles, your muscle contraction that pumps your lymphatics. Your arteries and veins are connected to the heart. So you got the cardiac pump of the heart to move blood through your vascular system, your arteries and veins. But the lymphatics are a separate system. They're designed to get the leakage fluid out, the waste products out, the white blood cells circulate around in them and remove cancer cells in there. So when you're not having good lymphatic flow coming out of the breast, you decrease the white blood cell, your immune system's ability to travel through there and remove cancer cells. Populations where they don't wear breasts at all, like in some areas in India, Singapore, Fiji, and some other places, they have a much, much, much lower risk of breast cancer. Now, I realize it's multifactorial. That can also in part be due to their diet. That could also in part be due to the fact that they exercise more. But in women in the United States that wear a breast less often, they have less risk of breast cancer. If a woman sleeps with her bra on at night, which some women do, increased risk of breast cancer. This lady, Dr. Elizabeth Vaughn, she's sort of a pioneer in telling women not to wear bras. And she's done a lot of work. She has a pretty good website. It's called brafree.org. And you'll go there. And also, I had a couple of scientific articles that I was going to include in this, but I'm kind of in a hurry and I forgot to do it. I actually was all ready to do it. And she'll give you the links to them. And it's relevant to see that because you're going to see these liars making YouTube videos saying, oh, bras have nothing to do with breast cancer. I don't believe it, because no one wants you to know anything, okay? Think about it. Breast cancer has been really high in this country for many, many decades. Does anybody teach all these poor, pathetic women anything? No. They run around with a pink ribbon, you know, and I feel sorry for them. They're all pathetic. We're raising money for breast cancer. They're just raising money for some chemo company. No one gives a rat's tail about patients, okay? They have no money. You patients have no money. Why should anyone care about you? You have no money. There's nothing you can do. Okay, so that's irrelevant because the drug company has billions of dollars, okay? If a doctor kisses butt to the drug company, they can give that doctor a free vacation, send him to the national meeting. They can do a lot of nice things for that doctor. A researcher, if he makes that chemo company happy, they can give him tons of money. They can support him his entire career, get him promoted to full professor, get him tenured, everything. He helps a patient. What can a patient do? A patient can say thank you. And that's why I'm telling you, you need these ethics. You need these Bible-based Christian ethics. Otherwise, why should anyone care about you? Oh, some institution. Well, guess what? That institution that's supposed to regulate the chemo, supposed to teach you, they're easily paid off. The big pharma company, they got billions of dollars. They just get their own people in charge of that organization, whatever it is. It will approve everything that makes them money. It will block anything. So no one wants to teach you this stuff, all right? It's important to get that through your head because I have all these patients and people I talk to, and they're all like, well, why doesn't this agency or organization or something help us out or do the right thing? And the reason is because they don't care about you. As a matter of fact, they might even hate you, okay? And you need to know that because you can't think intentionally until you realize you are on your own, okay? You are on your own. All you can do is understand the system and then figure out how to navigate it, all right? And if you're lucky, you'll run into a few people that care about you and that are nice. But, you know, don't get your hopes up when money's involved. Be careful. Okay, what else? Polyester, you know, poly mean polymer, ester, it's an ester, you know, like a carboxylic acid with an organic molecule replacing the hydrogen on the carboxylic acid. And the typical one is polyethylene terephthalate for polyester. Guess what? The phthalate is estrogenic. Okay, estrogenic chemicals. That's a lot of times the padding to make the breast look bigger. Putting that right on the breast, another estrogen, okay? So now we're up to 9 estrogens routinely are estrogenic or carcinogenic chemicals. They're being exposed to the breast. And a typical American woman. Okay, this was the big famous book, Dressed to Kill by Sidney Singer and Soma Grismaijer, all right? And they did a big study showing that the bras increase the risk of breast cancer. Many women wear their bra too tight. Like I said, some sleep with them, back up a lymphatic drainage. Oh, another thing, a lot of women these days are putting their cell phone in their front pocket. Stupid. It's a low-power microwave transmitter. You're microwaving your breast all day long. Very stupid thing to do. Let's see, what else? Shampoos and conditioners. You know, I don't have any here. I don't use a shampoo, but all these shampoos and conditioners, even a baby shampoo will routinely have 2 estrogenic chemicals in it, sometimes 3. And so if you're shampooing every day or if you're rubbing that on your chest, you don't need to soap your whole body, okay? I know some people think you have to soap your whole body. You don't, okay? Just rinse them off. No one cares. You know, our ancestors, you know, just going back in time a couple hundred years, they almost never showered. You know, they didn't even have a shower. There was no plumbing. Let's see, what else? So right now we're already at about 11 or more estrogenic chemicals or carcinogenic things being done to the breast every day. If you had to pick a material, probably organic cotton would be best. Silk is at least a natural fiber. Other things that increase cancer risk. If you're fat, eating a high-fat diet, you're more likely to be fat. You'll have increased estrogenic levels. Lack of sleep, excess stress, caffeine, all of those things decrease immune function. You need an immune system to remove cancer cells from your body. If you're not exercising enough, being sedentary means your muscles aren't contracting enough, so you're going to be less able to move lymphatic flow around the body. Exercise increases lymphatic flow 10 to 30-fold. And so it lowers your risk of breast cancer. Being sedentary increases your risk of breast cancer. Meat, milk, and ultra-processed food, UPF is for ultra-processed food, that has a lack of fiber, and so it will cause bad gut bacteria. The bad gut bacteria, they have more of an enzyme called glucuronidase. The liver normally takes the excess estrogen, excretes it into the bile, which then goes into our gut, and we defecate it out of our system. When you've got the bad gut bacteria, which comes from a lack of fiber, they'll have more of an enzyme called glucuronidase. And that will cleave the conjugation because the estrogen in the liver is conjugated, meaning connected to glucuronic acid. That makes it more water soluble in the bile and facilitates its removal from our body by defecation. So the point being is bad gut bacteria have more of the enzyme glucuronidase. It cuts the glucuronic acid off of the estrogen. Now the estrogen's free and it's reabsorbed into our body, so estrogen levels go up. If you're drinking tap water, that has very high, relatively speaking, high estrogenic levels of things like ethinyl estradiol, birth control pills, PCBs, BPA, phthalates, and other estrogenics. They're all in there, okay? If you're eating a lot of estrogenic stuff in your food from the meat and from other things, we're not going to get into all that now. Like the cows are pregnant, for example, high estrogenics. That's why kids, it's one of the reasons kids are going into premature puberty. All of these things raise your bodily estrogenic levels, increase your risk of breast cancer. If you're rubbing all this stuff on yourself, moisturizer, sunscreen. Like a lot of women, you know, they think they're smart. A lot of people, they think they're smart. Oh, you have to use sunscreen. No, I think sunscreen's stupid. I don't ever wear sunscreen. Now, don't get me wrong. If you're someone who has to work outdoors, there might be some situations where you need it, okay? And I have videos on what's the safest sunscreen. But I'm just saying, an average person, I don't need to go to the beach and sit there like an idiot all day. I can walk outside in my yard for 30 minutes, get all the sun I need, and forget about it, okay? You're spraying perfume on yourself down there, rubbing soaps on there, drinking alcohol. All those things increase cancer risk. So what I'm saying is a routine normal woman who thinks she has healthy habits is quite routinely doing 11 or more things every day that increase her risk of breast cancer. And all of this stuff is easy to avoid. And also, I got to tell you, you're going to see these, a couple people making YouTube videos. Oh, there's no association between bras and this. BS. You know, if you want to see the papers, and I did see the papers myself, but I forgot to include them in this talk, just go to her site, Elizabeth Vaughn. You'll see the links to them. It's under her drop-down menu for breast health, and then she's got the links to those papers. You can see them, plus from this book, plus it makes sense logically. So anyways, hope this is helpful.